Welcome back to another Clinical Conversations video. If you're new here, my name is Dr. Brian Larish, and I'm the owner of a cash-based physical therapy clinic, as well as the creator of the PT Growth Academy. Now, this series is all about quick discussions as to what's going on in the clinic that I think you may find valuable, that you can either practice with your patients or clients, or if you're a patient yourself, you can start to implement. So today's video is all about the pelvis and the foot in sync with one another. Now, I know this sounds really obvious, and we all pretty much probably know that we need these things to be in sync. But the one key part that I find is challenging for patients to understand is the first step that we bypass, and that is awareness. We need to increase awareness of how to control and move the foot. Specifically, what I'm talking about is how do we move into proper pronation and supination? We can get it through compensatory means, driving everything through here, and either moving the whole femur to drive pronation, moving the innominate bones to drive pronation, or conversely, the innominate bones and external to drive supination, and the femur driving out to produce supination at the foot. So we need to really increase awareness of the proper mechanics here. Here's the really cool part. When you can start to sync up the mechanics of the pelvis and the foot, you actually start to unlock two main things: mobility and performance. Actually, let's add one more in: decrease pain, right? Why decrease pain? Let's start the last one. Well, when we start to learn how to pronate appropriately, we start to learn how to drive force into the ground appropriately. When we can do that, the knee doesn't have to work so hard and find and produce force when it shouldn't. The hip joint shouldn't. The spine, right? So all these pain points that are really common can come back to we don't know how to pronate appropriately, which really means we don't know how to put force into the ground appropriately. Number two, performance kind of piggybacks along those lines. So when we can properly pronate and supinate, we can drive force. And as far as the performance side, that's when we're going to really be able to take things up a notch, because we will start to utilize the muscles in a way that they haven't been used before. Lastly, the first thing I said was increase mobility. A lot of times people are disconnected at the pelvis and the foot, and the pelvis is trying to generate pronation or internal rotation and pronation here, but we're stuck in an ER position. And as a consequence for that, muscles tend to stay on. They tend to stay tight, we'll call it. And so when we can start to get the foot more mobile in conjunction and in sync with the pelvis, a lot of times ranges of motion like hip internal rotation will start to improve when we improve pronation of the foot. Hip external rotation will improve when we start to improve supination of the foot. So those are the big three things that we can really start to create when we have these things in sync. Now, you might be asking yourself, how do we do this? It's super simple. All we need to do is practice going through isolated pronation and supination. Now, it's a little bit harder than it sounds, but what you can do to work on this is go on the ground in a hook-lying position, put a ball or a yoga block in between your knees. That way you can't move your knees in and out. And then you're just going to work on isolated, pronated, and supinated positions. Now, you're going to have to move really slow because it is challenging. You're going to find that the whole leg wants to help. You may even find that the upper body is trying to help. But what you really want to focus on is making sure that we're just generating foot pronation and supination through an isolated foot, and we're not compensating. So super simple as far as what needs to be done. The execution is a lot more challenging. So start to increase your awareness of, is the foot in alignment with the pelvis? And two, if it's not, which it probably isn't, start to utilize that really simple drill so you can have the benefits of increased mobility, increased performance, and decreased pain.